Good afternoon, everyone. My name is Monique Hardin Cordero, and I am the Senior Program Manager for the National Kidney Foundation serving Greater New York. And I want to welcome everyone in terms of thank you for joining us this afternoon. And sorry for the delay, but you're in for a wonderful show. Um, can you please go to the next slide? As I stated, my name is Monique Hardin Cordero, and I am so thrilled to have you join us this afternoon. And before I forget, there are going to probably be a ton of questions that the audience will have. And if we don't get through all the questions this afternoon, I'm going to let everyone know that they can send their questions to me, and I will make sure that your questions get to the appropriate presenter, and we will get back to you with an answer. So I wanted to state that up front, but there will also be an opportunity for you to post your questions in the chat as noted on the screen. So we'll do our best to get to all the questions. Next slide. This is our agenda, and I won't spend too much time on that. Next slide. I do want to take a moment to thank Horizon Therapeutics. Because of their generous sponsorship, we're able to bring this program to you this afternoon. Next slide. And here are our presenters for today. And we have a wonderful panel discussion that will take place. So without too much delay, I am going to turn it over to our first presenter, which is Dr. Leonard Stern. Next slide, please. Go ahead, Dr. Stern.
Okay, thank you all for being part of today's presentation. My hope is that I'll stimulate some new knowledge for you, and hopefully there'll be questions that you have that we can answer that will help you manage this condition. So today's learning objectives are we're try to explain what gout actually is, what it looks like, how it's diagnosed, what are the role of diet and hydration, and what are some of the treatment options. Oliver?
Hey, Oliver, you're muted.
Ok. Buenas tardes, damas y caballeros. Hoy día vamos a hablar de la gota, de qué es la gota, cómo es diagnosticada la gota y cómo es tratada la gota. Dr. Stern, back to you.
Great. So the disclosures, the presenters today report no significant financial conflicts of interest. Next slide. So what is gout? Gout is a very common form of arthritis affecting more than 9 million Americans. Gout is caused by a buildup of uric acid in the joints. Oliver?
Entonces hoy día vamos a hablar de qué es la gota. La gota es una manera común de artritis que afecta a 9 personas, a 9 personas en los 9,000 Estados Unidos. La gota es causada por la acumulación de ácido úrico en las coyunturas. Back to you, Dr.
Next slide. What causes gout? Gout is caused by the accumulation of uric acid. Advance. Uric acid is produced from normal cell activity and metabolism. It's a byproduct of purine metabolism. Advance. Uric acid is also produced as a byproduct of food and drink. And as you can see the pictures, there's a picture of red meat, of shellfish, and this happens to be beer. Oliver?
La gota es causada, 2/3 es causada por la actividad celular y el metabolismo. Y 1/3 de la gota es causado por la dieta. Aquí vemos ciertas comidas como la carne roja, ciertos productos marítimos y la cerveza. Back to you, Dr. Stern.
And although cell activity, metabolism, food and drink are both listed, as you could see, the cellular activity metabolism accounts for 2/3 of the uric acid production. Next slide. So uric acid in the blood is filtered by the kidney, advanced, and is eliminated in the urine. However, in the case of normal kidney function, the kidney is not able to eliminate all of the uric acid that's presented to it, and a significant amount is reabsorbed. Next part. Next. When the uric acid level becomes too high, the uric acid is insoluble in plasma above a concentration of about 7 milligrams per deciliter. Then it becomes crystals, and it goes to joints and many other parts of the body. Next slide. Next, advance rather. Then it begins to cause inflammation. Go back a moment. Okay, what's important here is that in the normal case, the kidney is not able to eliminate all of the uric acid, and this is significantly impaired in the setting of chronic kidney disease, where the ability of the kidney to eliminate uric acid is markedly reduced. Oliver?
El ácido úrico, la gota es causada por la acumulación de ácido úrico en la sangre. Usualmente, si los riñones están sanos, el ácido úrico es eliminado por los riñones, pero si los riñones no están funcionando al 100%, el ácido úrico se acumula en la sangre y se convierte en cristales. Y estos cristales se depositan en las coyunturas y en varias partes del cuerpo.
Advance. Next slide. So the risk factors for uric acid are listed on this slide, and I want to highlight that medical conditions such as chronic kidney disease and selected medications that are commonly used to treat high blood pressure, like thiazide diuretics. An example of this is hydrochlorothiazide or chlorthalidone. These are the most common risk factors that produce gout. It's clear that diet, obesity, family history, male and recent surgery and trauma are also risk factors, but these that are in bold are the most important. Oliver?
Los factores que pueden contribuir a la formación de la gota son la dieta, la obesidad, ciertas condiciones médicas como la enfermedad a los riñones, ciertas medicaciones como los diuréticos, la historia de la gota en la familia y recientes cirugías o traumas son todas condiciones que pueden contribuir a la gota.
Next slide. What does gout look like? So in this picture, you could see a joint. It's the big toe joint, because gout has a preference for weight-bearing joints, such as the big toe, the ankles, and the knees. When gouty crystals accumulate around the joint in the synovium, it causes inflammation and severe redness, swelling, and pain. This is a depiction of what the crystals actually look like. Oliver?
En este dibujo vemos como la gota luce usualmente. Aquí vemos que en el dedo gordo, en la coyuntura, hay acumulaciones de ácido úrico y los cristales se forman. Usualmente esta zona va a estar roja, va a estar dolorosa y va a estar inflamada.
Next slide. So common symptoms of an acute gouty flare. This is a picture of what it looks like in a hand, what it looks like in a toe. There's severe pain that could come on suddenly. It may actually increase over the first 12 to 24 hours. The pain could last a few days to a few weeks. It can spread to more joints. And the affected joint is swollen, painful, warm to the touch, and red, and causes disability. For many patients who have gout of their big toes, they're unable to walk. If they have it in the knees, it's disabling where they can't do any of the normal things of their day-to-day living. I think next slide. Now, uric acid can also build up in the tissue, and people that have had chronic gout and repeated episodes can develop these bumps, which contain inflammatory tissue and uric acid, and that's over here in these pictures. These actually, over time, don't hurt that much, but they're very disfiguring, but they're a hallmark of people that have had chronic gout. And these kind of inflammatory collections begin to irritate the bones underneath and will cause destruction of bones and joints over time. Next slide. Now, we have many different types of imaging that can identify uric acid. These are complicated x-rays. Unfortunately, most of these x-rays are not available in our region. Some of them are still experimental, but hopefully we'll have better tools in the future to be able to see uric acid in tissues. Next slide. Why is it important to treat gout? Well, the most important reason is gout is exceedingly painful, and if untreated, it leads to progressive disability and joint destruction. There's strong evidence that chronic gout can lead to a progressive reduction in kidney function, and high uric acid levels have been identified as a major cardiac disease risk factor for many, many years. And addressing the uric acid in gout is hopefully one way that we could reduce the long-term cardiovascular risk. Oliver?
¿Y por qué es importante tratar la gota? Es muy importante porque la gota puede ser muy dolorosa. Cuando la gota va progresando, puede llevar a la deshabilidad y la destrucción de las conducturas. También puede afectar a los riñones y puede contribuir a la enfermedad al corazón.
Next slide. So how is gout diagnosed? Well, acute gout is diagnosed typically when the joint is inflamed, and one way of diagnosing it is a rheumatologist can aspirate the joint fluid and look at it under the microscope, and there we identify uric acid crystals. This would require that you go to a physician or hospital to have this done. Next slide. The goals of treating uric acid are to treat the acute flare, the pain, and to begin to develop a strategy to prevent the flares from recurring. And one way we do that is we try to lower the uric acid levels, and in lowering the uric acid level, we hope that we can remove a buildup of uric acid that appears in the tissues. Oliver?
La meta de tratamiento de la gota es tratar de evitar los ataques de la gota. Se trata de prevenir la acumulación de ácido úrico en las coyunturas y en la sangre.
Okay, now these are some of the ways that we treat gout. In this first bar, we talk about lifestyle adjustments, which typically refer to diet and exercise. There are a variety of different medications that are used to treat the symptoms of acute gout. Then we have medications that can lower the uric acid levels. These are designed to help people manage the long-term effects of gout. And when these medications are insufficient, we even have more advanced medications that are given intravenously that convert uric acid to other more soluble chemicals in the hope of removing uric acid from the body. Next slide. So these are some of the drugs that you might be familiar with to treat an acute flare. They're called non-steroidal anti-inflammatory drugs. An example of this might be ibuprofen or Motrin, steroids, whether they're given orally in the form of methylprednisolone or injected, and an oral medication called colchicine. What's important about these medications is that these non-steroidal anti-inflammatory drugs are reasonable for people with normal kidney function, but they're problematic in people that have chronic kidney disease because these meds can make kidney function worse. So for people with advanced kidney disease, steroids and low-dose colchicine are our only remedies to treat acute flares. Oliver?
Ok, so aquí vamos a hablar de cómo se trata los ataques de la gota. Usualmente se van a utilizar medicaciones como los esteroides. También se van a utilizar otras medicinas que pueden ayudar con la reducción de la inflamación. Back to you, doctor.
Next slide. Okay, so after the flare is controlled, then if there are a significant number of flares in a short period of time, then we add medicines to lower uric acid blood levels. An example of this would be allopurinol or febuxostat. These work very well in people who have normal kidney function and also in people with chronic kidney disease. A medicine called probenecid increases the excretion of uric acid in the urine, and this is only suitable for people with normal kidney function. And pegloticase is an intravenous medication that converts uric acid to a soluble chemical, and this is reserved for more advanced cases. Oliver?
Y estas son las medicinas que son utilizadas para controlar cuando hay un ataque de gout. Las medicaciones aquí son utilizadas para rebajar los niveles de ácido úrico en la sangre.
Next slide. So when standard treatments don't work, then we consider the option of the intravenous medications, and that's beyond what we really want to talk about today. Today we wanted to highlight the most common treatments. More advanced treatments need to be reviewed with your specialist. Next slide. Okay, so now I'd like to introduce our patient. Our patient is Johnny Guzman, who is a patient followed at Columbia Presbyterian Medical Center. Hi, Johnny. Hope you're well.
Hello, everyone.
Perfect. Johnny, so for our audience, what I'd like to ask you first is, when did your gout first begin? Give us a highlight.
My gout first began in 2005, in the summer of 2005.
And how old were you then? How old were you then?
I was 35.
And
no,
where were you living?
30. Sorry about that.
And where were you living?
I was living in the Bronx, and my mother lived in Manhattan, so I visited the hospital.
Okay, and how was that? How was that treated? The first episode.
Well, before I answer that, déjame decirlo en español. So, yo tuve mi primer caso de la gota en el 2005. Estaba viviendo en el Bronx y no sabía exactamente qué lo era. So, me fui para el hospital para descubrir más o menos qué era lo que yo tenía, pero no me pusieron decirle en ese momento. What was your next question, Dr. Stern?
Well, first I want to thank you because I forgot that you're going to be translating. So the question was, how was the first episode treated?
My first episode, unfortunately, wasn't treated. They took X-rays of my ankle, and they told me that there was nothing wrong. Maybe I had injured it, and they sent me home, and they told me to take some Advil, I think, at the time. Unfortunately, that continued on, and well, I figured since there was nothing wrong with me, I just would take some Advil or, try to relax it for a little while. And that went on for actually quite years. So, nadie me pudo decir exactamente qué era lo que yo tenía para tratamiento. Y eso duró mucho tiempo. Yo iba para el hospital y desafortunadamente me decían que yo no tenía nada malo con mi tobillo en ese momento, que tal vez yo me había dado un golpe y no lo había notado. Y me mandaban para la casa tal vez con alguna medicina de, como Tylenol o algo simple. Pero en mi
So,
caso seguí y seguía hasta el momento que ya yo sabía no ir para el hospital porque no resolvía nada.
so if I understand correctly, then from that first episode, no diagnosis of gout was made, no specific treatment was applied, no education about medications, diets, or fluid, and no instruction about ways to prevent the condition from recurring.
Desafortunadamente, no. Unfortunately, no. There was no treatment.
So, how many years before the actual the first the first information that you had that the condition was called gout, and when you first began to get treated?
Actually, the first time that I found out that I had gout, I believe it was in 2008 or 9 in Florida. And though somebody told me that I could get steroid shots for it. So, la
But
primera vez que yo descubrí que yo tenía la gota fue en el 2008 y fue en Florida y alguien me dijo que yo podía coger una esteroide para eso en forma de inyección.
so, if I understand correctly, even when the diagnosis was identified, no specific preventive strategies were given to you. No information about how to prevent gout, no information about diet or fluids or medications were offered.
No, unfortunately, there was no medications. The doctor did tell me to eat better. I didn't know what that exactly meant, so I figured that it was just basically don't eat any fast food. En ese momento, cuando me dijeron de lo que yo tenía, no había ningún tratamiento, ninguna medicina que me pusieron. Solamente el doctor me había dicho en ese momento que coma mejor. Y para mí eso quería decir que no fuera para ningún sitio donde hacen comida rápida.
So if my timeline is correct, so sometime around 2013 or 14, when you began your treatment at Columbia Presbyterian, your gout was treated effectively and you were given appropriate instructions about diet, medications, and fluids.
That is correct. So thank God I came back to New York and I met a fabulous doctor and he put me on allopurinol and that made a world of difference. I didn't have the dread of being out of commission and not being able to walk. So gracias a Dios cuando yo me mudé para atrás para Nueva York y conocí un buen doctor y me puse en una medicina y eso hizo un increíble impacto en mi vida que por fin yo pude caminar regularmente sin ninguna preocupación de que yo iba a tener dolor.
And just one last question. After that initiation of treatment, have you had any flares of gout since?
Never again. My last episode that I did have gout was in May of 2016. I did have a transplant, thank God. And I believe the doctor had told me that I could probably go out without the medication. And unfortunately, I got another episode again, but I went back on medication and I've never had one since. So, en el 2016, yo tuve otro episodio porque yo tuve un trasplante y el doctor que yo tenía en ese momento me dijo que por mis nuevos riñones, tal vez ya yo no iba a necesitar de medicina, pero desafortunadamente me atacó otra vez y tuve que regresar para atrás a la medicina.
Johnny, thank you very much. I think you have been an inspiration to our audience.
I'm very happy that I could do so. Gracias a todo, me dio mucho placer decirle mi experiencia.
Okay, so now we're gonna go into the presentation on nutrition and gout. We're gonna talk about some of the do's and the don'ts when it comes to diet and gout. So ahora vamos a hablar de ciertas cosas en la dieta que afectan a la gota. Vamos a hablar de lo que se debe hacer y de lo que no se debe hacer. Next slide, please. So first, let's talk about foods that worsen gout. If you guys recall from earlier in the presentation, Dr. Stern explained how gout is caused by the buildup of uric acid in the blood and in the joints. So there are certain foods that contribute to the rise of uric acid. These foods tend to be high in a substance called purine. So the recommendation is to try and avoid foods like that. So for example, we have here organ meats, red meats, and certain seafoods are high in purine content. So the recommendation is to limit the intake to less than 6 ounces per day. Entonces, también hay ciertas comidas que pueden empeorar a la gota, porque estas comidas son altas en una sustancia que se llama purina, que hace que el ácido úrico se acumule en la sangre. Cierto tipo de carne, como la carne roja, como ciertos productos marítimos, como estamos hablando de las sardinas, cosas así, se deben consumir en moderación porque pueden aumentar los niveles de ácido úrico en la sangre. Next slide, please. So just like there are foods that can worsen gout, there are also foods that can help decrease the chances of gout attacks. Fresh fruits and vegetables are high in vitamin C, and they can help decrease the buildup of uric acid in the body and therefore prevent gout attacks. Foods like oranges, pineapples, and strawberries are good sources of vitamin C. Fresh fruits and vegetables are also high in antioxidants, and they possess anti-inflammatory properties, which can also help decrease the chances of gout attacks. Entonces, ¿qué estamos hablando de las frutas y los vegetales? Las frutas y los vegetales pueden ayudar a prevenir los ataques de la gota. Las frutas y vegetales son altos en vitamina C, también contienen bastantes antioxidantes y tienen propiedades que pueden bajar la inflamación del cuerpo. Entonces, todas estas cosas pueden ayudar a prevenir los ataques de la gota. Next slide, please. So now yes, thank you. So now, one of the worst things we could consume, not just for gout, but just for, our general health, is a substance called high fructose corn syrup. So high fructose corn syrup is an artificially made sweetener. It is mainly found in soft drinks, in processed foods, and in junk food. So you're going to find it in things like sodas, fruit juices, candy, sweetened cereals. My advice, try to avoid products with high fructose corn syrup. Like I said, it's not just bad for gout, but it's really bad for your heart health. And it is known to also, create issues with the development of diabetes. So please, when you purchase anything from the supermarket, look at your ingredients list. And if you find that that product contains high fructose corn syrup, put it back. Entonces aquí estamos hablando de otro tipo de comida que puede causar, que puede contribuir a que se forme la gota. Es una sustancia que se llama high fructose corn syrup. Esto es algo que tú lo vas a encontrar más en bebidas como las sodas, en ciertas comidas procesadas como los cereales dulces, la comida de los restaurantes, comidas rápidas. Entonces, este tipo de comida tienden a contener esta high fructose corn syrup, que se lo debe evitar porque es malo para la gota, pero es malo también para el corazón, es malo para la diabetes. Así que, por favor, cuando compren algo, lean la etiqueta de nutrición, lean la lista de ingredientes, y si contiene esta sustancia, el high fructose corn syrup, no lo compren. Next slide, please. So now let's talk about alcohol consumption and gout. Alcohol consumption can increase the risk of gout attacks, especially beer and grain liquors are high in purines. And again, there's that connection with high purine content of foods and the increase in uric acid. Now, if you are a drinker, moderation is advised. This is what moderation looks like. If you are a woman of any age, you should limit your drinking to 1 drink per day. If you are a man 65 years of age or younger, you should limit your drinking to 2 alcoholic beverages per day. And if you are a man 65 years of age and older, you should limit your alcohol consumption to 1 drink per day. Entonces también hay una conexión con las bebidas alcohólicas y la gota. Se sabe muy bien que la gota contribuye a la formación del ácido úrico. Entonces, si tú bebes alcohol, deberías practicar moderación. Si eres una mujer de cualquier edad, no deberías de consumir más de una bebida alcohólica por día. Si eres un hombre de 65 años o menor, no deberías beber más de 2 bebidas alcohólicas por día. Y si eres un hombre de 65 años o mayor, no deberías beber más de 1 bebida alcohólica por día. Okay. Next slide, please. So hydration. Hydration is extremely important when it comes to gout. Drinking plenty of fluids can help flush uric acid from the body. Definitely try to consume at minimum 8 cups or 64 ounces of fluid per day. Ideally, stick to water. If you're having a gout flare-up, try to increase your fluid consumption to 16 glasses per day. Just as a disclaimer here, if you are a person that suffers from kidney disease or heart failure, please double check with your physician as to how much fluid you should be drinking daily. Aquí estamos hablando de la hidratación. La hidratación es muy importante para tratar de evitar los ataques de la gota. La hidratación, el beber líquido ayuda a que se saque el ácido úrico en la orina. Por lo menos trata de consumir 8 copas o 65 onzas de líquido diario. Especialmente trata de beber agua. Si eres una persona que ya tiene gout y que ya tiene la gota, perdón, y te da un ataque de la gota, trata de consumir por lo menos 16 vasos de agua por día. Ahora, si eres una persona que sufre de los riñones o si tienes problemas del corazón severo, por favor, consulta con tu doctor para saber cuánto líquido puedes beber al diario, ya que a veces tienes que restringir la cantidad de líquido que puedes beber si tienes esas 2 condiciones. Next slide, please. So here we have a picture of Henry VIII. So Henry VIII was an obese man that consumed large amounts of red meat and wine on a daily basis. He suffered back then. It was called the disease of kings, better known as gout today. So the takeaway message here is that if you're overweight or obese, it puts you at a higher risk for developing gout. Belly fat, especially if you have a large midsection, this increases the production of inflammatory chemicals, which again can lead to the development of gout. So the takeaway message is to please stay physically active and definitely manage your weight. Entonces aquí tenemos una foto de el rey octavo de Inglaterra. Este rey se sabe que era obeso. Él consumía bastante carne y bastante carne roja y bastante vino todos los días. Entonces sabemos, él en esa época sufría de la enfermedad de los reyes, se le llamaba. Pero ahora esta enfermedad se llama la gota. Se sabe muy bien que ser pasado de peso o obeso pone a la persona a mayor riesgo a que le dé la enfermedad de la gota, especialmente las personas que tienen barrigas muy grandes. Esto incrementa la producción de inflamación en el cuerpo. Entonces, por favor, trate de mantenerse activo, físicamente activo, y trate de mantener su peso bajo, y esto va a ayudar mucho a que no se forme la enfermedad de la gota. Okay, next slide, please. And I think this is Dr. Sternat.
Yep. Great. Thank you, Oliver. So the first take-home message is we don't want to be like King Henry VIII, who suffered for his entire life with chronic gout, lived most of his life with his feet in ice buckets because his feet hurt so much he couldn't walk. Imagine that as a lifestyle for a king. But our take-home messages are straightforward. Gout is a very common disease, and it can be very painful. It's important to see a physician specialist to learn about how to manage gout. You can definitely do it. You as a patient can learn about medications, diets, and fluids. Although we can't cure this condition, we can successfully manage it, and you could live a comfortable life treating it appropriately. Oliver?
Entonces, ahora el mensaje que esperemos que ustedes se lleven para la casa hoy es que la gota es una enfermedad común y puede ser muy dolorosa. Es importante que usted vea a un doctor que sea especializado y que sepa tratar la enfermedad de la gota. Tú lo puedes hacer, tú lo puedes lograr con medicaciones, con la dieta y con hidratación apropiada. Esta es una enfermedad que se la puede ser manejada muy bien. All right.
Excellent. Okay, now what I'd like to do is open up questions to our audience. So if those could be, excuse me, directed at the chat box, or if there are some questions that are more detailed, you might send them as an email, and we'll try to respond to all of your questions. So first question is, what should the blood level of uric acid be to prevent gout? That's an excellent question. So what we know from the biochemistry is that any uric acid level in blood above 7 produces an unstable uric acid crystal state and could lead to accumulation of uric acid and gout. So ideally, we want to promote a level of 6 or less. We can try to do that to some degree with diet and fluid management, but most of the time that will require medications to reach that level of 6 or less. Oliver?
La pregunta fue, ¿cuál es debe ser el nivel de ácido úrico en la sangre para prevenir la gota? Lo que se recomienda es que el nivel de ácido úrico debería ser de 6 para abajo. Esto se lo puede ser logrado con la dieta, con la hidratación, pero la mayoría de tiempo se necesita medicaciones para lograr ese nivel.
So that's another great question. Are there natural supplements that help with gout? So the answer to that is complicated. There are a lot of advertisements about alternative medications, tart cherry juice, probably 50 different others. Unfortunately, none of these alternative therapies have been shown to be effective in either treating gout or preventing gout. And the most important part about it is if you resort to using these alternative therapies, you delay the actual treatment. So getting to the physician for initial treatment and education and then preventive strategies is really is a time-sensitive manner. You don't want the gout to persist for a long time, and then you put yourself at risk for joint and bone injury and cardiac risk.
Entonces la pregunta aquí fue si hay algún suplemento natural que ayude con la gota. En realidad no hay ningún suplemento que haya sido aprobado que trate la gota o para evitar la gota. Así que lo mejor que la persona puede hacer es si tienes esta enfermedad, tienes que ir a ver al doctor lo más pronto posible para que te comience con el tratamiento y de esa manera poder evitar que la gota progrese y te afecte los huesos o te afecte a la enfermedad al corazón.
So this question is, how much water should a kidney patient drink? So the answer to that will depend on the cause of the kidney disease. So for some patients who have what we call glomerular disease, the amount of fluid they need to drink is substantially less than for other patients who have conditions called interstitial kidney disease. So the first issue, we need to know more about what type of kidney disease we're talking about. On average, a kidney disease patient should limit fluids to about 2 liters per day, but that could vary a lot based on which condition is causing the problem.
Okay. La pregunta aquí fue cuánto agua debe beber un paciente renal y eso varía de verdad dependiendo en cuál es la fuente del problema de los riñones. Usualmente una persona puede beber hasta 2 litros por día, pero eso puede variar mucho dependiendo de dónde se está originando la enfermedad de los riñones.
So how often should the uric acid be tested? Well, that will depend on whether you are taking medications to lower the uric acid levels. So in general, if you're on medications, I recommend that blood tests should be done at 4 to 6 month intervals in order to make sure that there are no side effects from the medication. If you're not taking any medications to treat uric acid, then the uric acid level could be tested during an annual blood test, which I recommend for all of us because it takes a year to see some changes in our body biochemistry, and that's a reasonable frequency to get routine blood tests.
Okay. La pregunta aquí fue con qué frecuencia se debe analizar el ácido úrico. La respuesta es que si tú eres una persona que está tomando medicación para la gota, esos niveles deben ser chequeados de 4 a 6 meses. Pero si eres una persona que no está tomando medicina para la gota, ese nivel se lo debe ser chequeado anualmente y se recomienda que inclusive si no sufres de la gota, que ese nivel se lo chequee anualmente.
Are there any medications that should be avoided? So the answer depends. Well, I'll read into that question and I'll say, are there any medications that should be avoided if you have underlying kidney disease? And the answer to that is nonsteroidal anti-inflammatory drugs, which are used to treat acute gout flares. That class of medication can cause injury to kidney function. And we as kidney specialists try to avoid the use of those medications. Now, the other medicines that can raise the uric acid levels are called thiazide diuretics. Hydrochlorothiazide is a good example, or chlorthalidone. Now, those drugs are widely used to treat hypertension. They're very effective in the control of hypertension, but they also raise the uric acid level. And if a patient is not following a suitable diet and is not hydrating adequately, the uric acid level could get too high and a flare of acute gout could occur.
Entonces aquí la pregunta fue si es que hay ciertas medicinas que deben ser evitadas. La respuesta del doctor fue que si tú eres una persona que tiene problemas de los riñones, una de las medicinas que se debe ser muy cuidadosas son con ciertos diuréticos, porque estos diuréticos pueden incrementar el nivel del ácido úrico en la sangre. Así que chequen con su doctor si sufres de la gota y estás tomando ese tipo de medicina, eso te puede causar un ataque de la gota.
Now, it's also important to think that if the blood pressure is well controlled on those medications, we don't necessarily want to stop those medications, but we have to implement a strategy to prevent and treat gout in addition to the medications to control the blood pressure.
Okay. El doctor añadió que si tú eres una persona que sufre de la presión y estas medicinas diuréticas te están ayudando a controlar la presión, no es que esas medicinas deben ser paradas, pero se debe poner un plan que todavía puedas continuar esa medicina y que tu gota siga siendo bien controlada.
So, I guess there are no more questions from our audience. So, Oliver, if you may do me the honor, I'm going to speak really quickly and ask you to close out whatever I'm saying. So, I want to say once again, thank you first to our presenters. I hope everyone that joined us this evening learned something new, and they're on the path to living a healthier lifestyle for sure. But I want to add that this is a part of a series, and so please check your email because we will do a follow-up to today's presentation. So let me stop so Oliver can translate.
Ok, entonces lo que Monique estaba diciendo es que le queremos dar las gracias por habernos escuchado hoy. Esperamos que hayan sacado algo productivo de esta lectura hoy y que los pueda ayudar a vivir una vida más sana. Vamos a tener más programas como este en el futuro. Chequen su email y les va a llegar la información ahí.
And with that said, I hope all of you have a wonderful afternoon. And once again, thank you for joining us. And please continue to check all your emails for future programs. And excuse me, one more thing. Johnny, if you're still with us, thank you so much. Thank you. Thank you so much for sharing your personal story. I think it's
important.
Thank
you, Johnny. We're very appreciative of your being here.
Yes.
Thank
You're
you.
welcome.
Yeah. All right.
And
Thank you.
anytime.
Okay.
Anytime.
Okay.
Excellent. All right.
Bye.
Goodbye, all.